Thanks for joining me today on All Things Seniors with Anne-Marie. Today we're going to talk about what to do when the doctor starts talking about senior living and how different doctors have different opinions, so you have to be your own advocate. You show up to the doctor with your husband who has dementia, and for the first time the doctor says you need to start thinking about memory care. That's a really scary thing to hear, and it's really scary for the doctor to tell you that too. So the first thing I want to say is, if a doctor is talking to you about moving your family member to senior living or hospice, either one of those two things, that doctor is really serious. So if they say it, there's a reason they said it, and you should seriously consider their words. Just remember, you're your best advocate for your loved one, so keep those things in mind. We're going to use an example that has absolutely nothing to do with senior living so that you can understand that this is how doctors in general work. So a few months ago, I hurt my knee. And my mother said, oh, you have to go to Dr. So-and-so. He's wonderful with knees. He did great with my knee replacement. So I went to that doctor, and he was amazing. And then he did all these tests. And at the end of it, he came back and said, well, you don't need your knee replaced. And I thought, well, of course I don't. I just hurt it. It doesn't need to be replaced. But as he quickly pointed out, his specialty is replacing knees and hips. And so he did not know, he did not have any desire to know beyond that what could be wrong with my knee. So he sent me to an orthopedic surgeon that specializes in knee surgeries. That guy said, let's put you in this brace for a few weeks, wear it day in, day out, and if it fixes the problem, we've got a quick little surgery that'll fix that. Well, you know what? That quick little surgery, when I looked it up, was going to be 6 weeks at home and then 6 months of rehab before I could get back up on my feet and being normal again. So again, that's where you're your own advocate. You know, there's a difference between putting off the inevitable when you're in horrible pain and knowing the difference between this hurts this much, but the surgery and the recovery is going to be this, and those things don't add up. So that's what we're going to kind of talk about here with seniors. Okay, so we're back in the doctor's office, right? And he says, okay, it's time for memory care. So why did he say that? What happened to make that doctor say that? And what kind of doctor did you go to that day? If you went to a neurologist, they're going to want to medicate and perhaps put in a memory care scenario, right? But if you went to a surgeon, say for my knee, they want to cut, because that's what surgeons do. If you go to a psychologist, they want everyone to go into treatment. They want you to have therapy. They want you to have those type of meds. If you go to a faith healer, they're going to want to pray over it and, you know, spray some sage around. Whatever kind of doctor you go to, remember that doctors practice a specific discipline, meaning this doctor is really good and really focused and studies this one thing. And while an internist studies a whole lot of things and a general practice doctor studies a whole lot of things, they still wind up with little niches. You know, you'll go to this people and they'll have very young patients, and you'll go to this other person and they'll have older patients. So just take all that in mind when they say memory care, and know that that can mean 1,000 different things. Let's think it through. If you need help thinking it through, give me a call. I appreciate talking with you today. Bye-bye.